Let us learn about urinary tract infection or UTI. What is UTI? Start from definition. Infection of urinary tract due to significant number of microorganisms causing signs and symptoms. Like there should be a significant number of microorganisms with the presence of signs and symptoms. What do you mean by significant number of microorganisms? Significant number of microorganisms means if there is presence of one bacteria in suprapubic aspiration, or there is presence of 10 to the power 5 chloroniform units in clean catch urine, or there is 10 to the power 7 chloroniform urine chloroniforming unit in catheterization sample. That is called significant UTI. Like UTI is more common, like the male is to female ratio less than 12 months is male are more prone, but after 12 months the female are more prone to UTI. We have different terms like asymptomatic bacteriuria. If there is significant bacteriuria with no sign and symptom, that is known as asymptomatic bacteriuria. And what is sterile pyuria? If there is pus cell in urine, that is known as sterile pyuria. How much pus cell? If the centrifuge sample of urine contain 5 pus cell, or uncentrifuge sample contain 10 pus cell, then it is called sterile pyuria. And the cause of sterile pyuria is incomplete treatment or incomplete medication. Like the UTI are of two types: the lower UTI or upper UTI. Lower UTI is infection below the urinary bladder, and upper UTI is infection above the urinary bladder containing kidney. There are different risk factors for UTI. In children, the risk factors are one is sex, that is female. In the use of diaper for more than 24 hours is a risk factor. The congenital anomalies are the risk factor, and a vesical reflex is the risk factor, and chronic complication is the risk factor, and there is a recurrent pinworm infection is a risk factor. Neurogenic bladder is the risk factor. All these are risk factors. The UTI is of two types. One is simple UTI and one is complicated UTI. Simple UTI is there is only urinary tract infection without any kidney abnormality. If there is UTI with abnormal kidney anatomy, then that is called complicated UTI. Signs and symptoms of UTI. In neonate, the signs and symptoms are like fever, vomiting, jaundice, poor weight gain, diarrhea, lethargy. In child, the symptoms are of lower UTI. Lower UTI is pain in hypogastric region, increased urgency, burning, micturition, flank, hematuria, and stable fever. In upper UTI, there is high-grade fever, chills and rigor, sick-looking child, hypotension, tachycardia. On upper UTI, there is renal angle tenderness in sign. On examination, we will look for renal angle tenderness, suprapubic tenderness, palpable kidney, distended bladder, and tight phimosis, and neurological defect in lower limb. Like in investigation of UTI, we will look for urine routing and examination. Like on visualization, we will see dirty cloudy colored urine. In deep stick test, we will see mild proteinuria. In microscopic level, we can see pus cell that is greater than 10 pus cell. We can also do nitrate test, leukocyte esterase test. The common organism causing UTI are gram-negative organisms, mainly E. coli, Klebsiella proteus. All these like E. coli, it releases nitrate. So we will do nitrate test. Other bacteria, Staphylococcus aureus, Staphylococcus epidermidis, Candida, and virus are rare. After we will do the urine culture. Urine culture will see the growth of organism, and also we can do a sensitivity test for the giving proper treatment. We can do RFT to assess the kidney function. We can do electrolyte studies. On imaging, we can do USG. We can do micturating cystourethrogram. We can do dimercaptro. We can do dimercaptosuccinic acid test. If the child is less than 1 year, we should do all the three tests: USG, DMSA, and MCUG. If the child is 1 to 5 years, we should do USG and DMSA. If DMSA come abnormal, then we should do MCUG. If the child is greater than 5 years, we should do USG. If the USG is abnormal, then only we should do DMSA and MCUG. Like in treatment, if there is simple UTI, then we can, like, if the child is not so sick and the vitals are stable, we can use oral third generation cephalosporin, that is cefixime. If the cefixime is resistant, then we can use IV aminoglycoside. For complicated case, we can admit the child, we can assess the grade of dehydration, we can do fluid maintenance, and we can use specific antibiotic, that is third generation antibiotic, that is IV ceftriaxone, along with aminoglycoside. We can use it for 48 to 7 hours. Then after that we can shift to oral antibiotic. The duration of antibiotic is for sterile UTI. We can give up to 5 days of treatment. For pus containing urine sample, we can give 7 to 10 days. For upper UTI, we should give treatment up to 10 to 14 days. The complication of UTI are it can cause vesico-ureteric reflex. In kidney, it can cause hydronephrosis, fibrosis, chronic kidney disease, and ultimately renal failure and death.